Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. Excited for today's guest. This is a repeat performer. So glad when doctors come on. So glad when experts take their time to share. So I want to thank Dr. Lincoln Harris for being here. Dr. Harris, say hello to everyone.
Well, thank you so much for having me. And it's, as always, it's a pleasure to join you. And hi to everyone who's listening at wherever you are in the world.
Yeah, I know the accent. People are probably guessing that you're maybe from Australia. I think you are from Australia, but you're one of my neighbors right now here in Colorado. Let's jump right into the program, do what we always do. Why don't you start by telling us how you got involved? How did Ripe Global start? What was the need that it filled?
I started running hands-on courses for dentists. It really grew out of social media, actually. And that's where the name comes from. The name was a Facebook group called Restorative Implants, Perio, Endo. And people started asking me where I learned all the things. So at some point, I started teaching hands-on courses over a decade ago, like 12, 13 years ago. And then along the way, we had two big innovation cycles. The first one was about 2016, where we realized traditional hands-on methods don't really work, as in you don't learn by getting a lot of lectures and doing a single repetition of something on a bench top in a Hilton Garden in between your buffet lunch and your afternoon tea. And so we started focusing on how pilots learn, which is through heavy repetitions of actually doing things. Yes, they need theory and didactics and knowledge, but knowledge doesn't teach you a skill. So that was back in about 2016. And then about 2020, we said, if no one could ever fly again, how do you actually, in a plane to an event or a course, how do you teach a course? So we developed simulation. It was a response to COVID. And then we continued doing it because we saw that dentists learn faster and also they implement better. They implement like 4 to 6 times as much if they practice in an environment that's very similar to treating a patient. So those were the big, I guess, milestones that led to where we are now. And then, of course, I moved to the United States because Australia has, even though it's the same size as the 48 states, it has an economy and a population about the same as Los Angeles. So you can build a good-sized business in Los Angeles, but you can't build a massive one. So that's the brief history of how we got here.
Yeah, that's fantastic. We're going to jump into here in a little bit some courses. I'm going to pitch some courses that you've got coming up. I know they're a great investment for dentists, so we'll get there in just a minute. But before we do that, why don't you talk about some of the challenges? You're out talking to dentists, you're teaching, you're in the thick of it. Tell me, what are some challenges that you see dentists are having?
Individual dentists have very different problems to people who own practices. They're like different sides of the same thing, but individual dentists, we find at dental school, they learn things because they have to. So most dental students would avoid doing most of the things they have to do, except that they won't get their degree if they don't, because it's, for a normal functioning, well-balanced person, it's actually quite scary to do a surgical thing on a person for the first time. And it's scary because, one, you don't want to harm them, and two, because you don't want to mess things up and fail. So part of it is just your personal internal satisfaction, and the other part is just the natural care that one human has for another human if they're a normal functioning person and not a complete psychopath. So that unfortunately goes away the moment you graduate. So no one has leverage over you to make you do things the way dental school does. And so it's then entirely self-driven. Now, there's a small proportion of dentists who very easily and with significant overconfidence go and learn a whole range of new things, but they're not the majority. So individual dentists we see almost universally anxious or nervous about doing new procedures, often think that if they do more courses, eventually they will feel confident, and you don't. You don't feel confident by learning, you feel confident by doing. They often are afraid of failure. So dentists are very failure avoidant, very helpful for getting into dentistry and getting through your degree, very unhelpful for learning things thereafter. We often see people struggling with perfectionism. Perfectionism is a tremendous burden for those of you trying to be excellent because it stops you trying. People who want to be perfect don't try because they're not perfect. And so then they just become static. So, and then just things like the cost of dentistry. So people often think about how the patients are afraid of the cost of dentistry. They don't generally think about the fact that the dentists themselves are also afraid of the cost of dentistry, often more than the patient. So it's like a huge issue. So these barriers that dentists have are things that we find, and they're basically universal. You see them everywhere in the world. So, like I've taught people how to do treatment planning in about 20 countries, and they have the same issues pretty much everywhere. And then I guess an incredibly deep tension between the fact that all dentists who don't work for free sell dentistry, but they don't want to be seen selling dentistry. And this is because of a fundamental misunderstanding of what sales actually is, because dentists are not trained in it and they don't understand it. And so what they actually mean is, I don't want to be bad at selling, because bad salespeople are very pushy, very dishonest, very sleazy, very slimy, like all the things that you think of when you think of a salesperson is a bad salesperson. So they're the things that we find people are struggling with.
When you're talking about salespeople there, if I can interject here a little bit, I think most people feel this way, not everybody, but when you run into a good salesperson, you love it. Like when they take care of it, when they're on top of it, when they answer the questions, when they provide a high level service, when they don't sugarcoat anything, and you know that they're being straightforward and honest with you and telling you what they believe is in your best interest based on the wants and needs that you shared with them. That's a great experience. Everybody loves that experience. I don't know anyone who doesn't love that experience.
The thing is, though, when you have that great experience, you actually don't notice that you're being sold to. So people exclude that example from their mindset of salespeople because you don't notice. The only examples people have are bad ones.
Yeah, that makes sense to me. So talking about treatment planning, I'm going to micro dive into there, and then we'll start talking about some courses here soon. What are some of the big mistakes that you see the doctors make when treatment planning, or better yet, when sharing those treatment plans with patients? What are some things that you think can be changed that would make it much easier on both?
So the two biggest mistakes that people make, the first one is treating the teeth and not the patient. And then probably more than that, the vast majority of dentists don't treatment plan the patient, they treatment plan themselves. So what do I mean by that? Let's say you're afraid of rejection. You take rejection very personally because this is your treatment plan, and if the patient rejects it, they're rejecting you and you take it personally. Quite often, dentists will offer much less. They're basically pre-rejecting the patient. So they're rejecting the patient so the patient doesn't reject them. So they basically offer the patient significantly less treatment than would be ideal for that patient based on their goals because they're avoiding being rejected. And so at that point, you're actually not treatment planning the patient, you're treatment planning how you feel when you get rejected. And so this happens in costs. It happens in, like, if a treatment is more expensive than you're comfortable with, often a dentist won't offer it. If a treatment is a type of treatment that the dentist is not comfortable with, they won't offer it. So you can see, actually, there's a whole range of reasons dentists don't offer treatments, which have nothing to do with the patient and everything to do with the dentist. So that's very difficult to deal with. That's on the planning side. On the actual delivery side, the general rule is the more that you talk, the less treatment you do. So if you're sitting there doing a big, long, complicated discussion and explanation of why you should do a certain treatment, the patient is actually less likely to go ahead with it. So very, very effective communicators actually don't say that much. They mostly ask questions, and then the patient tells you what they want, and then you go, okay, well, this is what you've just told me. If I can give you that, would you be happy? That's it. So we generally don't let people use more than 3 sentences when they're discussing a treatment plan, no matter how complicated.
Yep, that's smart. I think it definitely keep it simple. Makes a lot of sense for sure. Let's jump into some events. So our website, by the way, folks, is ripeglobal.com. Highly recommend that you give it a look, that you check it out. There's a ton of information on here. You can dive deep, right? So you have online classes here. I know that you offer membership. I think they should go to the website and check that out. Feel free to talk about that a little bit. But then let's also talk about some in-person events. I'm not sure if it's too late for people to get in on that one.
That's for rapid, efficient treatment planning, where we go over both, how to deliver your treatment plan simply and also how to actually treatment plan. I think we ran it in Orlando recently. It was sold out. The demand for that course is crazy. We run it about 20 times this year. I teach it once nearly every week now, because we obviously run it for individual doctors, and then for large dental groups, we run it specifically for their doctors alone. And then hand skills or actual procedural training courses, they run virtually, because when we're teaching people, we want them to be learning in their own chair. So we ship the mannequins to the dentist, they put it on their chair. So if they're doing a crown prep exercise, they join from their operatory. And it's a class at a certain time, but they join from the operatory. And we do that because people learn faster. You learn faster if you practice in an environment very similar to what you treat patients. And so, there's a new restorative dentistry class starting. So that's probably the entry level for usually younger doctors who are less than 10 years out, who want to learn how to do complex restorative dentistry.
I know you also have membership program. Can you kind of give us the 40,000 foot view on your membership program, what that looks like, the benefits of it?
Yeah, the membership is, one, you get to join our community, which is a private online community. So you're not you don't have all your stuff shared all over social media. A patient can never get hold of it. It's all vetted. Everyone in that community is people we've vetted to make sure they're dentists and or clinicians, or at least in the industry. So you get that. And then there's about 900 hours of video. So you can get any level of training on all sorts of topics. And it can be as easy as you just need to get your CPD up for getting your Masters of the Academy of General Dentistry, or your annual CE hours, or you want to learn about a specific topic. So a couple of the videos in there, I've had people tell me that they have changed their life, particularly the communication ones. And so there's all sorts that people can delve in there. So we find that often people join the community and then the membership, and then they tend to move into our sort of 1 or 2 year fellowship courses in restorative, and then they tend to go into implants or aligners. And at that point, if they're very good, then we ask them to come back and help us teach.
Love it. I got one more question for you, and we'll get you out of here. I'm going to throw you this one. It's kind of a newer question I've been asking a little bit. What are one of the big impacts that you think AI is going to have on dentistry?
It's going to speed a lot of things up. The biggest impact AI will have is it will shorten the feedback cycle. So right now, someone calls on the phone, unless you have a consultant listening into the phone calls, it might take you weeks or months to actually correct phone call problems. Whereas if you've got something like Patient Prism, you're going to get a dashboard showing you feedback on how your phone calls can be better instantly in real time. You have AI listening to you while you're doing an exam. It's uploading the notes. The chart and the notes and everything are done in real time. As the AIs learn, it'll give you feedback on how you actually presented your consultation to the patient, and it'll give you real-time feedback on how you could have said this, you could have said that. This patient really was showing signs of interest and you ignored it. You take a scan, you upload it, the smile design's done. So it's shortening the loop between doing and the result gets compressed to almost instantaneous.
Yeah, it's going to be fun. Dr. Harris, thanks so much for being here. Folks, check out ripeglobal.com. Anything else you want to add before you go?
Look, if you're a practice owner or you're a group of practices, we run very specific programs for that, and we're getting incredible results with those. So, our last group that we worked with, their return on investment on working with us was like 50x. That's pretty unheard of. So, if you employ a whole bunch of dentists, you want to help to get them productive, I think we can outcompete just about anyone in the market.
Love it. Yeah. Dr. Harris, come back, would you?
Yeah. Thank you so much.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.